Scan.
Alright, so my name is Emma, and today is November 13th, and I'm going to be doing a sterile care on my patient. I will come in, provide privacy, knock on the door, provide privacy, wash my hands, and I will introduce myself to my patient. Hello, sir. My name is Emma Hayford, and today I'm a student nurse. I'm going to be doing a trachea on you. Could you tell me your name and your birthday? And I'll check that on your wrist. Okay, sir. Thank you. And I'm going to be putting on a gloves. Okay. And I will take down your oxygen. And I'll put, before the procedure, I have a towel that I'll drip my patient on. My patient is already in a semi-final position. I've gathered my supplies. And now with my gloves, I'm gonna take off the old dressing. I'm gonna look at the dressing for color, amount of drainage, and any odor and anything like that. And I'm also going to inspect the skin and see whether there's any breakdown. And I can see the skin is nice and dry. And I will give back the oxygen. All right, and I'm ready to set up my sterile field. So I'm gonna open this away from me. Then I wear my gloves. The inside the gloves, and I'm gonna be pouring everything in here on the gloves. And I'm going to have my normal saline that came in the kit. I'm gonna have it open and put it on the field. Then I'm ready. I'm gonna open this up, put it in 3 compartments. It says 2 on there, but I'll just put it on the 3 one. 1, 2, 3. Then I'm ready to dirty my non-dominant hand. So with my non-dominant hand, I'll take down the mask, and I will take down the inner cannula. And since it's dirty, I'm gonna come in like that. Here, with my clean hands, I'll reach out to the brush, and I'll wash, go inside, clean it really good, and rinse it right here. And this, then now it's clean. If I want to dry it up, I can take one of this and dry them up, and go behind and put it back in there, let it click. Then now I'm ready to clean around the skin. So take one of these in the other compartment that has not been used. I'll go like 12 o'clock, clean back of the skin, clean back, and that is dirty. Take the second one, put it in a clean one. Then from 12, go anti-clockwise. All right, and that goes in here. All right, so now I'm ready to make sure the place is dry. So get it out, clean, go back and really clean good. Okay, and that is dirty. Now I'm ready to fix my dressing. And as I'll be careful not to disturb the inner canal, the trachea. use that bit a little bit higher and make sure I get it out of the back. All right, then now I'm ready to take this down and tie it up with that. So as you can see, I don't have help right here, so I'm gonna take this down. I'm not gonna use scissors, it's a Velcro, so I take it off. Okay, and with this, this one I'll ask somebody to hold, say, and say my patient can lift his neck if it's so my patient will give me help, and I'll have somebody hold the trick. Then just one will go in there. Then I'm gonna tie it up with one up, looking like a square. All right, and take off my gloves and clean up my base and give back the oxygen. Then now I'm gonna be documenting that I've changed the tie up, and I'm also going to document whether my patient tolerate this procedure, and I can see my patient oxygen level is good. And now give my patient a call light. Then now I'm gonna be doing sectioning at the same time, so I'll gather my supply. My patient is in the right position. My patient is in the semi-fallow position already. My patient has a towel around him. My patient has an oxygen. And before the procedure, I'll turn down the sectioning all the way up. And I'm going to hyper oxygenate